Now to the big news story, not just in Kenya, but around the world. Now, in response to the Omicron variant's discovery in Southern Africa, the United States, Canada, Russia, and a host of other countries joined the European Union in restricting travel for visitors from the region, where the variant brought on a fresh surge of infections. This coming even as the World Health Organization warned against overreaction before the variant has been thoroughly studied. And as Raquel Migai reports, despite the country issuing a warning to Kenyans to adhere to all Ministry of Health guidelines in relation to COVID-19, it appears that the reality on the ground speaks differently of a country that is still recording new COVID-19 infections daily.
For those who had planned their trips to countries in Southern Africa to celebrate the December festivities, it appears those plans will have to be rethought if the current travel bans by a number of countries are to continue. Britain, the European Union and some other countries introduced their travel restrictions on Friday within hours of landing of the variant, Australia following suit by suspending flights in 9 Southern African countries.
Effective immediately, anyone who is not a citizen of Australia or their dependents and who has been in African countries where the Omicron variant has been detected and spread within the past 14 days will not be able to enter Australia. These countries are South Africa, Namibia, Zimbabwe, Botswana, Lesotho, Eswatini, the Seychelles, Malawi and Mozambique.
According to the World Health Organization meeting that named the variant Omicron, terming it as a highly transmissible virus of concern, the Omicron variant has a large number of mutations with worrying characteristics.
We understand that people are concerned. The good thing is that we have monitoring systems around the world to detect these variants very quickly. This variant was detected a few weeks ago, and already scientists are sharing research with us, information with us, so that we can take action. What's really important as an individual is to lower your exposure. The measures, these proven public health measures, have never been more important.
Health experts say the variant's emergence illustrated how rich countries' hoarding of vaccines threatens to prolong the pandemic. While the new variant has added anxiety among many scientists, fearing that it could reverse months of progress of containing COVID-19 through vaccination, WHO is asking that there be patience as the research continues.
The vaccinologists and the vaccine manufacturers will have to go to the drawing board to ensure that they tweak the existing vaccines to be able to address the change in the architecture of the virus.
As the rest of the world rushes to close their entry points, increasing their surveillance to prevent the spread of the disease driven by the Omicron variant, here in Kenya, COVID-19 appears to be a thing of the past. Masking and social distancing, words that are no longer a thing in people's lives.
People are copying from the leaders, but if our leaders can be strict on some of these issues, we'll just follow suit.
Kenya, like the rest of Africa, is yet to vaccinate half of its population, a situation that raises fear among many who believe the gap could help speed up spread of the virus. Raquel Migai, Citizen TV.